Hello, today is Tuesday, October 27th, 2020. My name is Mariana Navarro, and I'm interviewing Carmen Valdez for the Voces Oral History Center at the University of Texas at Austin. Please know, Mrs. Valdez, that this interview will be placed in the Nettie Lee Benson Latin American Collection at UT Austin. If there's anything that I ask you during this interview that you do not wish to answer or talk about, I will honor your wishes. Also, if there's something you want to talk about, please make sure to bring it up and we'll go ahead and talk about it. Because we are not conducting this interview in person, I do need to record you consenting to the interview. So I'll be asking you a series of 5 questions, and please say, yes, I agree, or no, I do not agree after each one. There are a couple of questions we need to make sure that you do agree to continue this interview. Before we go on, Voces wishes to archive this interview along with any other photographs or documentation that you provide us at the Benson Library at UT Austin. We will retain copyright of the interview and any other materials that you donate to Voces. So do you give Voces consent to archive your interview and your materials at the Benson Library?
Yes, I do.
Okay, wonderful. And then do you grant Voces copyright over the interview and any materials that you provide us?
Yes, I do.
Wonderful. And lastly, do you agree to allow us to post this interview on the internet where it may be viewed by people around the world?
Yes, I do.
Wonderful. So we had lots of questions during our pre-interview form that we already filled out last week. We use that information from the pre-interview form to help us in our research, and the entire form is kept in a secure Voces server. Before we send it to the Benson, we have stripped out any contact information for yourself and for your family, so that will not be a part of your public file. Your public file will only be accessible at the Benson Library. Do you wish for us to share the rest of your interview in your public file available to researchers at the Benson?
Yes.
Okay, and lastly, on occasion, Voces does receive requests from journalists who wish to contact our interview subjects. We only deal with legitimate outlets and sources. Do you agree to consent for us to share phone numbers, email with your or with other journalists?
Yes.
Okay, wonderful. So that was the end of our little preamble, our little spiel. So to go ahead and get started with our actual interview and the questions, first, can you just tell me a little bit about yourself, about where you're from, what you do, what you're currently doing, what you've done? So yeah, just tell me a little bit about yourself.
Okay. So I am psychologist by training, a licensed psychologist in the state of Wisconsin. I was born in El Salvador, San Salvador, El Salvador, in 1970, and lived there until I was 9 years old, before moving to the US, where I lived for 6 years and then returning to El Salvador. And then finally came back to get a master's degree and then a doctoral degree.
And what have you done a little bit in your professional life? Where have you worked? What have you worked on?
So I have, as I mentioned, a doctoral degree in educational psychology. And what I did with that is, so my work focuses on family stress, and particularly around immigrant Latinx families. And so for the first 13 years of my career, I was an assistant professor and an associate professor at the University of Wisconsin in Madison, where I conducted research on issues related to racial justice and mental health disparities for Latinx immigrant families. And I developed a program, a clinical program there that's called Fortalezas Familiares, and implemented the program with families whose mothers were dealing with depression. And so I worked with these families, we recruited them from mental health clinics, and then subsequently also from elementary, middle, and high schools. But we invited the whole family to participate. So the mother, if there was a father, in most cases there was, and then children ages 9 to 17. And we helped them try to understand what depression looked like and meant in their lives, and help them identify goals for the future. And then 2 years ago, I transferred to the University of Texas at Austin, where I am the chief of the Division of Community Engagement and Health Equity for the Department of Population Health at Dell Medical School. And I also have an appointment at the Steve Hicks School of Social Work as an associate professor. And so here in Austin, I've been partnering with different community organizations to think about what the needs, the mental health needs of the Latinx community is, and to develop a mental health promotion model that can better help us identify people with mental health needs, to determine the type of services that they need, and then to refer them to those appropriate services. So we have a collaboration with the Mexican Consulate, with Migrant Clinicians Network, and then working with other partners as well.
Right, of course. And how and why did you decide that you were interested in studying to be a psychologist or to study the topic of mental health? Kind of what was the catalyst, or why did you decide that this was something that you wanted to do in your life?
Yeah, I think it was a combination of lived experiences, as well as just some professional directions that I, was just at the right place at the right time. So when I was a child in El Salvador, I was the youngest of a family that had 4 children, lived with my parents, and the country was going through a great deal of civil unrest, and erupted in the Civil War back in 1980. And so I was 9 years old at the time, and I got to see a lot of people suffer. Became just very familiar with the stress of sleeping in a bunker at night, but then during the day going to school, playing with friends, having a normal everyday life, right? But death and danger became part of that life, and so I got to see my family experience the stress and the fear of uncertainty and of potentially something terrible happening to my family. And so as a result of that, we migrated to San Francisco, first Milwaukee, and then after a year to San Francisco, California. And so then I had the immigrant experience, or lived the immigrant experience. And so I think those were some of the first times in my life where I became very attuned to stress and distress, and how those personal ways of coping interact with things that are happening in our environment. And then I think even from when I was 10, 11 years old, people like my friends would say to me, you should be a psychologist, because, they all thought I was a good listener, and that I was very calm and just kind of had the presence of a therapist. And so I think some of it was just my personality trait, that, I have a curiosity towards people, and a sense of an interest in people's lives. And and so it was very early ingrained in my mind that I could be a psychologist and that it would be something that I would like. So those were some of the personal motivations. Then when I was getting working towards my master's degree in psychology, I was in Baltimore, and I got a job as an assistant to a faculty member who was very interested in maternal depression. And so we were working with families in Baltimore and in Washington, D.C., working with the moms and doing an assessment of their children to see what impact maternal depression had on children. So I didn't seek that. It was just a job. For me, it was a job, but it really, it gave me the opportunity to dive deeply into a specific area of mental health that I then became very interested in, and then just kept working in that area. And afterwards, I left to do a doctoral degree in psychology, and I still continued to work in the area of parental mental health. And that's just been my trajectory ever since. The area of parental mental health, of family stress. So just the combination of personality traits, personal experiences, and then just these opportunities, kind of coincidental, lucky opportunities that really helped me to just dive in or lean in a significant, meaningful way.
Right, of course. And do you think that those personal experiences that you had, as an immigrant coming to the United States, that those have kind of shaped how you look at mental health and how you operate within your research or just within, your professional life? Do you think that's definitely had an impact, or has it had an impact?
Oh yeah, for sure. I think, and especially because I tend to look at, even though I focus on maternal depression, I tend to look at the whole family. And so, usually families, the things that they care about are not just the parent's mental health. They also care deeply about whether, the children have what they need, whether, the parents have the stability, whether they have social support, spousal support to parent and to feel confident in their ability to parent. And then, of course, outside of the family, you have pressures. Do you have a job that is stable, that gives you protections, that is not exploitative? What is the current immigration climate? And so all of those are things that my family experienced in our journey and in coming to the US. And so I think it gives me certain intuition about what these families might be experiencing without assuming that my experience is the same as theirs. But it does give me a framework that, when I read a theory, I'm like, yeah, this makes total sense. And I remember that in my own family.
Right, of course. And, when we were doing our pre-interview, you mentioned that you were a postdoctoral fellow at Johns Hopkins, and that was something that you did in your life. And so what do you think that you learned from working at the Department of Mental Health in Johns Hopkins? And what did you take away from that you kind of still use today?
Yeah. So an institution like Johns Hopkins has a lot of resources for research, for trainings. And so what being there really helped me is to see the possibilities of my work. Because what I learned in my doctoral degree at UT was, so I learned to understand families' experiences and mental health experiences, and also how to be a therapist. right? And I learned to do research because I had to complete a dissertation and all of that. But being at Johns Hopkins really exposed me to the different types of grants that I could pursue, trained me in how to apply for those grants, taught me different types of quantitative and qualitative methods that I could use in my research so that my data collection is more robust, so that my interpretation of findings is more rigorous, and also really exposed me to experts in the area of mental health and of research and of developing interventions, that you wouldn't find anywhere else. And so I feel like for those 2 years, I really I got to see the array of techniques that I could learn and use in my research, and then also see how experts in the field were using them. So I felt much more prepared to do research once I started my first faculty position, because I had already been through that experience there with the resources and assets that come with being at Johns Hopkins.
Right, and that's wonderful that you got, that enriching experience that you could take with you and, just learn a lot from that. And so kind of going in a little bit more towards what you've noticed in research and just the general mental health of Latinos in the Latinx communities. What makes Latinos more or less likely, do you think, to seek mental health counseling or to seek professional help as opposed to other ethnic groups?
First, I want to say that I think Latinos are a very hardy group in the sense that they've experienced change, and change is part of their life. They've usually, when we think about immigrants, we think about people coming from another country, but even within their country before they come here, they migrate a lot in search of better opportunities. And so they have experienced change throughout their lives. And when they come here, the changes that they face in this environment, although many of them are different types of changes, but they've already accepted that change will be the norm, and they've already adapted and learned coping strategies to manage change. And so I think, one takeaway is that this is a population that has experienced a lot of change even before coming to the US, and therefore they have a level of hardiness that prepares them for life and for the changes here. The other side of that coin is that they've also experienced a lot of loss. They've had to leave family behind. They've been forced to come to an environment that is colder, different language, where their foods may not be available. The comforts of their culture, of being around extended family, all of those are comforts and assets in our lives that get lost in the transition to the US. And that can be really difficult. And then on top of that, with immigration policy becoming more and more hostile, more pressure to hide, to become invisible, I think that has long-term consequences on people. And obviously we choose to become more invisible, but that's not out of our own choice, but it's out of necessity so that we can preserve our family. And so I think that rhetoric and that state of constantly being in hiding or in a state of invisibility can be very damaging over time, and can also be very oppressive, because the more invisible we are, also the more likely we are to be exploited. It means that we have to take jobs that don't expose us, but then that don't protect us either. And so I think the combination of those factors can be very damaging over time. And so you have that state of hardiness that you develop throughout your life from having experienced a lot of change throughout your childhood to your adulthood, from one country to another, from migration within one's country. But then you have these pressures that become chronic and severe, that can take a toll on people. And I think that's where you start to see mental health concerns. And for some people, seeking mental health services is not acceptable because of stigma. But I also think for a sizable number of people, seeking mental health services is not, it's not that it's not acceptable, it's just not available. There aren't enough supports, there aren't enough services that are, that meet appropriate guidelines and that are in their language, near where they live, convenient to their work schedules or their lives. And so I know a lot of people talk about stigma and how that keeps people from seeking help, but I think that may be true for some people, but for others, it's just not having the resources made available to them to actually seek the services.
Right, and so going off of that and having those resources available, for example, something that kind of comes to mind is language for Latinos who either speak only Spanish or are more comfortable speaking in Spanish and are more comfortable and maybe seeking help in Spanish. Do you think that there is a lack of resources specifically for them? A lack of psychologists or therapists who speak Spanish and who are able to effectively help them the same way that they would if they were English speaking? Do you think that's something that's a factor?
Yeah, and also that the Latinx community is very diverse, right? And so we have older populations that need a type of mental health support that is going to look very different than what a 15-year-old would need. And so, like, I know for my 83-year-old mother, religious-based counseling would be ideal because she's a very religious person. Or counseling with other older people, like group counseling, would be ideal because she really needs that connection to people who have had a similarly long life, and that have the connection, the roots to Latin American culture. A 15-year-old might need something very different, might need more, Western based type of medicine or Western based approaches, or maybe more amenable to Eastern approaches like yoga, meditation, than, an 83-year-old would be, right? The problem is that both of those groups are underrepresented in mental health services, meaning there aren't enough support services for 18 to 25-year-olds because they're either for children or they're for adults with children. But so young adults really struggle to find services that are developmentally appropriate. And then I think older adults really struggle to find services that are culturally appropriate. And then within those groups, you have Latinx folks who were born in the US, others who were not born in the US, but have become naturalized or are citizens, which was my case. And then you have folks who do not have citizenship, do not have residency or a valid visa. And so they're here without documentation, and that means that they also don't qualify for national insurance programs like Medicaid, Medicare. And so then the cost of services becomes prohibitive. Even if those services, even if the person needing the services is a child or is a parent with children, and those services are available, but they can't afford them because they don't have insurance. So I think that's the type of barrier that on the one hand, they may not be enough services. On the other hand, those services may be there, but because of barriers associated with immigration policy and how it marginalizes some groups, then those groups cannot access the services that are available. Language, is another, or transportation, or, a lot of different other barriers that people face that, where they work multiple hours. And if mental health services are from 9 a.m. to 5 p.m., there's a big chunk of people who are at work, cannot take time off because they don't have time off or vacation time or sick leave. And so the barriers are just insurmountable for them.
Right, of course. I mean, that would make it incredibly difficult to be able to get to those resources. So we've kind of touched on this a little bit, but, what are some of the most common, you think, issues or problems that Latinos seek mental health for? Do you think that there's a certain area or something kind of specific that kind of shows a pattern of what Latinos typically endure, what Latinos, the issues that a lot of Latinos face? And do you think that these have changed over time, or do you think that they've stayed, consistent?
Mm-hmm. I think that common issues that Latinos seek mental health services for are depression, anxiety, so stress-related concerns. A lot of the women that I've worked with have, for the reasons that I talked about earlier, are not able to return to their country of origin, which means that they've had to miss their parents' funeral, or they have not been able to reunite with a child that they left behind. And so those interpersonal losses can be very difficult to, not only are they difficult to face, to make meaning of, but they also become cumulative. So first you lose one parent, and then you lose another parent, and then, people around you that you left behind, that you promised that you would see again, that you thought you would be able to reunite with in a short period of time, you're losing those relationships. And so I think interpersonal loss, stress-related, often can contribute to depression and anxiety. I think for some people, it manifests as depression and anxiety. For other people of Latin American descent, it manifests as like somatic complaints, headaches, backaches, sometimes even the sensation that you're going to have a heart attack, or like chest pain, because those may be more culturally acceptable ways of channeling stress. And so often you don't see those people in mental health settings, but you see them in primary care settings because they're coming in for a physical symptom. And I think it's really in the best interest of physicians to ask about what's happening in their lives that could be stressing them or causing stress to them, so that they could then make a referral to mental health services. I think for children, especially children of immigrant parents, they carry a very heavy weight. They carry the expectations of their parents to do well, to succeed, to help the family, to be successful at school, at the same time to be loyal to the family, to the culture, to not become too Americanized, to, they carry a huge weight that looks more like acculturation stress, right? So our parents tend to, if they work, they tend to work with other people who speak Spanish. They tend to interact with neighbors who, like them, may even come from the same community in Mexico or wherever they're coming from. So acculturation for them happens at a lot slower pace than it does for children who start school at a young age and immediately learn English and are exposed to different types of peers and norms. And so there's this constant pressure of, you need to become a valuable citizen, but you can't lose your roots at the same time. And I think that pressure can take a toll for children. And then I think lately, because of immigration stress and immigration policy, a lot of children also carry the burden of their parents' undocumented status. Even if the children are citizens themselves, even if they were born in the US, a lot of the actions or the decisions that they make, or a lot of the judgments that they make about what they can and cannot do, are often anchored in, would this be detrimental to the family? So that's a lot of pressure for a child or for an adolescent. And I think those may be some of the issues that may be bringing them to therapy.
And with those pressures and those issues that, Latinos face, and, everything that you just talked about, do you think that do you see any difference between young boys and girls, or men and women, and how those issues kind of manifest themselves, or how they're dealt with? Have you ever seen a difference in how a woman deals with it compared to a man, or a young girl compared to a boy? Is there anything that you've seen that's different, the same? What kind of does that look like?
Yeah, I think there's a lot more pressure on girls to help the family, to not assimilate, to help the younger siblings, help the family, do things that are in the interest of the family. I think those pressures are more pronounced for girls than they are for boys. And what that can translate into is a sense of no escape for girls, that to be good daughters, they have to be loyal and obedient and helpful. And at the same time, they have the desire to be more autonomous and to be in, to have strong friendships and to be in intimate relationships. And those two pressures often stand up against each other. And so there's a lot of shame that they can experience about, that if they focus on friendships, I don't want to say too much, but if they perceive that if they focus on their friendships, then they're being disloyal to the family, and that can bring a lot of shame. And sometimes, and there's a researcher at UT, Luis Sayas, whose research shows that these girls can have high levels of suicidal ideation because they feel like they can't escape the situation that they're in. That either they're loyal to the family and helpful to the family always, or they are disloyal to the family but loyal to their developmental desires and needs and what peers in the outside world are doing. So I think that's one way that it might be different. I think those are pressures that boys don't experience in the same way.
Right, of course. And kind of touching on what you said earlier about how it's an issue of, stigmas versus availability. And we've talked about how the availability really plays a factor in Latino mental health and, seeking that treatment, seeking that help. But what do you think are some of the stigmas that are attached to mental health within the Latino community? Is it different between different Latinos, of different origin? Is there kind of stigmas that just exist all around? What are those stigmas that are within the Latino community that kind of make mental health something taboo or something, undesirable or something like that?
Yeah, I think because we're part of a collectivistic culture, the actions of one person reflect on the collective. And so if we let others outside the family see that we are not, holding it together, so to speak, then that is a negative reflection on the whole family. And so I think there's obviously variation in that. Like if you grow up in a big city, that stigma may be lessened than if you grow up in a small village or a remote town where everybody knows each other, where, having a therapist would be like completely unacceptable because that therapist knows who the family is. And so there's the expectation that problems are worked through within the family, and also because not just that it's a collectivistic culture, but it's a hierarchical culture, there's also the expectation that problems are worked through top down, right? Like parents tell you what to do and they have your best interest in mind, and therefore that's what you do. And if and there's almost this idea or notion that should be enough, and it's not enough. It's not enough, but just that's how the cultural norm was developed. And so I think that then carries over to decisions about seeking mental health. So you may have parents who say, just go to church, talk to the priest, or pray that it goes away, or just be happy. I mean, look at everything we've sacrificed. Can't you just be happy or content with what you have, right? Because they're approaching the problem from their frame of reference, which is, I came from nothing, and look at everything I've had to sacrifice to give you the life that you have, and now you're not appreciative of that sacrifice, right? But the reality is that the child is not rebelling or lacking respect. It's just that the pressures that they're experiencing in this country are pressures that their parents even didn't experience in their own country, right? They may have experienced classism, but they haven't experienced racism in the way that you would here. And so youth need more than just go to church, talk to a priest, pray to God, or be happy with what you have. But you really have to work with the family, which is why I think you can't just, my work is all at the family level, because you can't pretend to work with a child and then send them back to an environment where these cultural norms haven't shifted yet. You have to work with the whole family to help them see what it is that each person needs within the family and how to best meet those needs, so that you do create the cultural shift, and then it becomes a more validating and more supportive environment.
Right. And so you working with the family, do you have any specific examples of something that you've seen, or a family that you worked with, where these stigmas, working as a collective, as a whole, as a family, to try and get through any mental health issues or kind of get through any problems? Do you have any specific examples of where, working as a family helped to kind of get to the root of the problem and help the family or the person who was experiencing these issues kind of move forward?
I think I'm thinking of a family, and maybe even the examples that I gave kind of came from that family where the father was very stern and very stern with the children, and had very inflexible ideas of what children need to do, and I think the children are in a very different place because, again, they're not growing up in Mexico. They're growing up in the States where the environment is very different, where they have, they're trying to prove that they belong here because they were born here. But they get this constant pushback from society that they don't belong, that, they're not deserving to be here. And the parents just don't understand. They don't know how to deal with that. And so they just focus on the strategies that worked for them when they were younger. Very different generational approach. And so I think, in that one family that I'm thinking of is really helping, acknowledging, I think you can't just say you're wrong, right? So like really acknowledging that the parents' earlier experiences were critical in their lives. And that yet, even those early experiences that shape who they are now were not the experiences that shaped who they were then. And that who they were then, just like their adolescent children, is a process that needs to develop over time, and it comes with maturity, and it comes with, supports and lived experiences. And that rather than focusing on what we as adults think our children need, is to focus on asking children what they need. And so really, and then I also think that reframing parents' ideas about their children as, deeply caring for their family and wanting to keep their family protected and safe. I think it's important that you validate that, and that you say, it's clear that you care so much about your family. And because of all of the different separations and losses and changes you experience in your childhood, you want to protect them and embrace them as much as possible, right? How can you show that now based on the needs of your children? Not the needs that you had when you were a child, but the needs of your children in this context. How can you show that love and protection and embrace? Because you want to highlight the values, not necessarily the approach. And so by highlighting the values of caring and loving and protecting and embracing, then you can start thinking about other things that you can do that are aligned with those values. So really helping families identify what their values are and taking those values to new situations so that they can be more adaptable in their approach. But you're not robbing them of their past or of their lived experiences or of their values. So that's an example of how you would work with the family to better align them with the current needs of their children.
Right, of course. Thank you for sharing that example. That was really insightful. And kind of now shifting a little bit more to the pandemic and kind of how it's affected yourself and, Latinos and mental health in general. So firstly, for yourself, how has your job as an associate professor for the Steve Hicks School of Social Work, how has it changed since the beginning of the pandemic? What are all the changes that you've had to go through, since this started in March?
Well, I think the most obvious change is working from home. I went from thinking that we were going to work from home for a couple of weeks to 8 months later, still being in my home office. which means that I still have interactions with my colleagues, but they're more rushed, pressured interactions, like going from one Zoom meeting to another. And they feel pressured because we don't have the break time in between where you're walking from a conference room to an office, or where you're walking from one building to another. Usually between meetings, when we were all physically together, there would be downtime. And now there is no downtime. Now we hang up with one person on Zoom and we immediately connect with another person on Zoom. So I think that's been really hard. It's felt very burdensome, not having the downtime. And in some ways, the other change is that I have more meetings now than I ever did when we were physically together, because somehow the convenience of connecting online makes it more acceptable to meet than before. So I feel stress from that. And then I also feel stress for my children because they're also in school from home. And if I have 7 Zoom meetings a day, then they're just on the other side of this door, but I have no idea what they're doing. And they, as children, they have needs and they need my support. And so balancing my mothering role with my professional role has been a challenge. I think my other concern is for my mother, because she lives by herself and I'm the only person she sees, once a week or so, and I bring groceries to her and all that. But I feel an additional level of pressure that I need to take care of myself because I don't want to get her sick with COVID. And so thankfully, and knock on wood, I have been healthy, and she's been healthy. But it's an uncertain time, it's a very uncertain time. And then probably the other thing is that with what I was talking about, us Latinos having experienced a lot of change in our lives. I mean, as a child, I went through a civil war, migration, returning to that country. So like acculturation, reacculturation back to my country of origin, moving back to the US. That's a lot of change. And this kind of brings up, those losses, those changes. And so I think it's an additional stressor.
Right, of course. I mean, these unprecedented times, they just, they came out of nowhere, and then suddenly everything changed in an instant, and we had to, kind of get used to all these changes and, try and make a normal, which has been, exactly like you said, very difficult. And so what did your normal day look like before this pandemic, before all the craziness, all the Zoom meetings that you have jumping from one to another? What did your normal day look like at your job, at home? What was just a normal day for you before this all hit?
So a normal day would have been waking up at around 6:30 a.m., getting ready, getting lunches ready for my girls, and then driving to the office, where I would have probably had 2 meetings per day. And the rest of the time would have been writing, writing manuscripts or grants, maybe meeting with the research coordinator for my projects, but would have been maybe 2 or 3 meetings. That would have been, and then hitting traffic in the afternoon, an hour sometimes, coming home and preparing dinner, spending some time with my family, but then getting ready for the next day. Now Do you want me to talk about now?
Yeah, sure. Go ahead.
Okay. So now I still wake up at 6:30, but I'm able to exercise or do yoga because I don't have the driving time anymore. So that's something positive that hadn't happened before, aside from the not having to be driving somewhere. I can be in sweats from my waist down, sweatpants, and just wear a nice shirt. I don't use mascara anymore. I used to put on a full makeup, and I don't anymore. So in that sense, I feel free, free, comfortable, more relaxed. I like the comfort of taking a break and going downstairs to the refrigerator and grabbing a snack and not being bothered by colleagues or, people that you would have to be interacting with. At the same time, 3 days out of the week, I assign to meetings, and I usually have around 7 meetings in those per day in those 3 days. So by Thursday, which is my writing day, I'm exhausted, I'm frustrated, I feel like I've aged significantly in those years, or in those hours. But it's also because in the middle of the pandemic, I was promoted to 2 leadership positions. So I think if I had not been promoted to those leadership positions, I wouldn't have 7 meetings a day. I would probably have, 4 meetings a day. But because I was promoted to direct a program, the Community Driven Initiatives program, and then also promoted to be the chief of my division, I have many more administrative meetings to attend, and leadership meetings and programmatic meetings. And so that's just like exponentially increased the amount of work that I have. And all of this happened in June. These promotions happen in June. So on top of the changes that I mentioned to you, I had this like exciting 2 opportunities, but that also bring about more work.
Right. And kind of like you said, it's the little things, right, that kind of keep you going, the not having to put on mascara, being able to just be in your sweats or leggings. It's the tiny things that keep us going through this time. And so kind of going along with that, you've dealt with research in mental health. You know how important this topic is. And so what do you do during, this really difficult time, having to be at home, having to adapt to these changes? What do you do to maintain your own mental health and to not be as weighed down by, all the uncertainties that this pandemic has brought us? So what do you do to kind of keep your spirits up and try to maintain your own mental health through this time?
Yeah. So I think those self-care strategies of yoga, I don't know how I could have made it through these past 8 months without my yoga. It gives me purpose. I'm able to set an intention for the day. It allows me to be more aware of my body and what my body needs and what my mind needs. So I think that self-awareness has just been really crucial. So that the other thing that we've done at home, because my office is my home and my home is my office, is that after a certain amount of time, so like after we finish with this interview, I go downstairs, I don't come back up, so I create a total separation. And on weekends, what we do, so on Friday nights, we've instituted family movie night. So we usually order pizza or something that the girls would like. And then we binge on some type of series. Like we just finished the Star Wars series. And before that, it was the Marvel movies. And before that, it was Jurassic Park. And so we create those routines that are out of the ordinary from the rest of the week so that we feel the change from the work week or the school week to the weekend. We also then on Saturdays, we go to a state park. We make a point of doing that so that we can also feel like we're out of the house, socially distant, safe, but out of the house. And then on Sundays, we'd like to grill or do something that, again, we wouldn't do during the week because it helps us feel like it is a real weekend. It's something, it's a different space that we're in, different mindset that we're in. So those are some of the things that I've done to take care of my mental health. Also, what I do is once or twice a week, like on my writing days, I go to my mother's house because I know she appreciates having my company, but I also appreciate the quietness of her house. And so, and then she usually cooks something really delicious for lunch, you know, something that involves beans and tortillas and you know, some type of comfort food. And so those are some things that, again, some of them we were very intentional about and very planful, and other things I've just discovered that have been helpful to me.
Right, of course, you know, having those routines, creating those routines really does make a difference. And kind of going along with that, have there been any moments, I mean, like you said, you have Zoom meeting after Zoom meeting, our Zoom meeting right now, you know, just a whole lot in your professional life. Have you had any moments during this pandemic where your mental health has suffered, or where you found yourself maybe having more anxiety or just thinking about the pandemic in general, just because it is so worrisome? Have there been moments throughout, you know, these past couple of months where your mental health has taken a toll because of the times that we're living in right now?
Oh yeah, for sure. For sure. I remember in the beginning of the pandemic, I was having a really difficult time sleeping because I think I was anxious. I didn't know what was going to happen with my mother. I was afraid that one of us would get sick because it was so unknown of how people could get sick. So I know that losing sleep had a lot to do with just being worried and not knowing what was going to happen in the future, whether I could keep my family healthy and safe, and worry about things running out at stores, right? Like, what if we go to the store and there's no more meat? You know, there was a time when there was a shortage of meat or shortage of toilet paper or paper towels. And again, just being in a unprecedented situation and trying to figure out what was going to happen. So that's gotten better since. I think the other toll that I experienced is that I felt like I wanted to over clean my house. So every day I kept my kitchen counters spotless, and I would also like cook rather than eat out. So I was cooking almost every night and turning it into something fun so that it would be fun for the girls. And so I was making bread and doing this. And after about a month, I was totally burnt out. I was like, I just couldn't keep up with that pace. And so I just had to let some things slide and, you know, let's go out and get some takeout. It's okay. We can, you know, I don't have to cook every night. So, and then I think lately what I felt is not necessarily a sense of, you know, that excessive worry that I had in the beginning. I think what I feel now is more fatigue, like just tired of being in this situation, of not having a normal life, whatever that means now. So yeah, so just feeling fatigued and at the same time very grateful for the health that we have and for the opportunity to spend more time with my family. I talked to, or as part of this work, I've led some webinars and I co-facilitated a support group for community health workers. And a lot of what I heard from them was that that the shutdown measures was the first time that they got to rest, that they didn't have to be at work every day in however long, that they couldn't remember a time where they could just be home and not do anything. And I think, those are things that people feel very grateful about, and they shouldn't feel ashamed of or embarrassed to say it's the reality of our lives.
And at what point did you look at this pandemic and think, man, this is something serious? Like, at what point did you really think we're in it for the long haul? This is going to be something that we're going to be in for a while. It's very serious. When did that realization kind of come to you?
There's so many different points of that. I think seeing how the president of the United States has not taken it seriously enough, I think that's one point throughout this time that's been really discouraging. I think seeing how numbers go down and then they go up again just makes it feel like we're in this for a long haul and we're not going back to the normality that we knew. We might create a new normality, but I don't know what that looks like. So I think just the fact that we don't have a vaccine yet, and incompetent leadership, and that the infections are continuing, going up in some places, which means they could go up here as well. I think all of those. I can't tell you like it was this one day, but it's just like a series of experiences and perceptions. Yeah.
Right, of course, yeah. It just kind of keeps on building.
Yeah.
And kind of looking towards Latinos during this time. So we've seen that Latinos have been disproportionately affected by COVID-19. And so do you think, all the stuff that we've already talked about, the Latinos have had to go through so much change, and because of the situation that we currently find ourselves in, what are you think some of the added stresses through COVID-19 that kind of put a strain on Latino mental health during this time and kind of just add to what was already there? What do you think COVID-19, how has it changed Latino mental health during this time?
Yeah, well, I think COVID has just put a spotlight on all of the barriers that Latinos face. So I think the biggest stressor, or two big stressors. One is that Latinos are more likely to be in these essential or frontline work that puts them at risk of getting infected. And two, the fact that many of them work in industries like construction or grocery stores or restaurants that don't have protections, and in terms of sick leave or any type of leave. So, and because testing has been so inadequate, that if in Austin you go to get a COVID test and you have to wait 11 days before you get your result, you're not going to stop working in those 11 days, because if you don't work, you don't get paid. If I don't work, I still get paid. But the majority of people are in the types of jobs that are in insecure jobs, unstable jobs with few protections. And so I think that's the biggest issue that creates stress, is how you're going to continue to feed your family when, if you're sick, and how long is that going to last? And you have to make some difficult decisions. I mean, you can't watch your children not eat. You just can't do that. And so, you know, it means that you do continue working even if you're sick. And then I think that, you know, creates a never-ending cycle, right?
Right, of course. And, you know, like, as you said, the factors just, you know, keep on going, and they just keep on having an impact on Latinos and mental health. And so, in your opinion, do you think either during this time or following, whatever it may be, that this, you know, we start to go back to a normal, whatever that is, do you think that we'll see an increase or a decrease in Latinos trying to seek mental health help? I mean, we've talked about the barriers that are there, of course, but do you think that because so many people are struggling right now and there's just so much going on that affects Latinos and just, I guess, the world right now, do you think that we'll see an increase or a decrease in Latinos who do decide to seek help for any issues that kind of came up during the pandemic?
I would hope so. And I would think that the type of mental health support that they might seek is grief counseling if they've lost a loved one, whether it's here or in their native country. And, you know, Latinos are overrepresented among those who have died nationwide. And so I think there's probably a lot of need for grief counseling, but also just for resilience building strategies, like how to, you know, understand what we've lived through, what are the skills that we've learned that we can apply to, you know, what are the small acts, small things we can do to appreciate the health that we have, the situation that we're in. And yeah, I think for a lot of people, definitely need for depression services, stress, excessive worry, all of those are going to be unmet needs. And I'm hoping that there will be more services for that, but also that the demand will mean that people will be more likely to seek those services.
Right, and continuing to look at the future and, you know, whenever that is, a lot of people have said, or, you know, there's a lot of things that COVID has kind of exposed. COVID has highlighted or illuminated the fact that, you know, we lack resources here, or we need more help here. And so what is something that that you think needs to change in order to better address mental health, you know, in general, and specifically, I guess, within the Latino community after this pandemic starts to subside, or we start to, you know, kind of go through changes again? So what do you think needs to change really in these areas to help better what we've all gone through COVID?
I think one of the things that needs to change is that we need to listen to the community. We need to involve the community more in the design of mental health interventions, in the design of mental health research, because we have for far too long developed programs or developed research that assumed what they needed and then found out the hard way that, you know, that was not what was relevant to the community. Or that even if it was relevant, the approach wasn't adequate, was not culturally acceptable. et cetera, et cetera. So for example, with COVID, even they popped up a whole bunch of testing sites, but they were all drive-up sites. Well, turns out a big chunk of the Latino community doesn't drive or doesn't have reliable transportation, and not all public transportation, would take you to these sites, right? Well, the community spoke out, and so now they allow for walk-up sites and more of them, So we really, as professionals, we can't know everything that the community, or let me take that back. We don't know every potential barrier that the community faces, but we should know, and we should do that by involving community members more in designing these types of programs and interventions and resources than we have in the past. I also think that by involving community members, we will inevitably address the root causes of mental health issues. Because as a researcher, or having developed the program Fortalezas Familiares, I focus on families that have a parent with depression. But that's because the training that we receive tells us that we have to have a narrow focus so that we can be rigorous, and we know that so that we can exclude bias and noise in the data, right? That's the Western approach. But I think what working with community members tells you is that focusing on maternal depression is not enough, or that, maternal depression comes from exploitation, marginalization, separation from family, persecution, all of these different things. And if you really want to target maternal depression, you have to address those different conditions. And so community members will not let you get away with, let's do this intervention to reduce symptoms. They will advocate and prioritize all of the different things that need to change in their environment for them to be able to thrive in their lives. And so I welcome that. As an intervention developer and researcher, I welcome that community involvement. And that's one of the reasons why I was thrilled to step into that leadership role of the Division of Community Engagement and Health Equity, because I really believe that it is through engagement that we can do research that matters, or we can provide a service that matters. Not just through our scientific knowledge of our area of interest.
Right, of course. And then looking towards something very important coming up, obviously we have a presidential election. We're in voting season right now. Early voting is going to end on Friday. And so what would you like the upcoming president, whether it stays Trump or whether Biden gets elected, to address concerning mental health? Where do you think the pitfalls have been in, like, I guess, the federal level of mental health? And then what would you like to see the president, whoever that may be, address concerning just mental health, especially after a time like this?
Yeah. Well, where do I begin? I feel like we need to have more empathy, first of all. We need empathy leadership, and grief leadership. So we need leaders who understand what all of us are going through and who care about what all of us are going through. And if that basic precondition is met, then the future president can then promote policies that will support people. One policy is the Obamacare, the ACA. And the ACA provided more opportunities for people to get mental health, but, and let me first say the and then I'll say the but. So provided more opportunities for people to get mental health services, and required that that services be designed with community input. So that was a very important step. But if you are an undocumented immigrant, you do not qualify for the ACA, for the Affordable Care Act. And so I think policy that needs to, first of all, we need to keep the Affordable Care Act. And second of all, we need to strip the condition of citizenship, because the truth of the fact is that if we're trying to save money, but if by saving money, we are not supporting segments of our population and in a dire need, which is mental health, then we're doing harm to society as a whole, right? We cannot afford to have individuals in society who have significant mental health need and no access to services. It's just not a good solution, because then those people end up committing suicide or in domestic violence situations, or conducting violent acts, or just really suffering in terms of their ability to function in society and in work and in all aspects of life, right? And that affects everyone. So we can't try to save money or try to keep people out by withdrawing essential services from them. And so I would definitely say keep an Affordable Care Act, the Affordable Care Act, or something like it, and then improve it. And then, in addition to that, we need to address racial injustice. We need to address poverty in society and inequitable distribution of services. We need to improve, change the way that people are taxed so that schools don't receive taxes that are paid based on the value of people's homes, but they equitably receive funding regardless, so that every child has an opportunity to learn and thrive. So we need to overhaul the world, so to speak, overhaul society and the way that policies further marginalize people, which all then contributes to mental health.
Right, and like you said, we have a lot to work on, lots to try and get through with that. And so, big question, but exactly like you said, there's just so much going on. And then also, you touched on this briefly, and this kind of ties into this topic. So, you said earlier Trump had very tight immigration policies, and when Trump was elected in 2016, it was definitely a very, very big event for the country. I mean, obviously he's the president, and then with the rhetoric that he had towards Latinos during his campaign and during his presidency and kind of thereafter, do you think that in 2016 when he was elected, and kind of, I guess, preceding it too, how did it affect Latino mental health? Do you think it affected Latino mental health at all? What was kind of something that you noticed or you saw during that time that you think is relevant towards this?
Yeah, for sure. I think it had a very significant effect on Latino mental health, in the sense that it created more threat and more deprivation for Latinos. So the threat of deportation became more real, more prevalent. The threat of family separation became very real, something that I don't think any of us would have imagined any president would have done. Well, it's been done and redone, And now we can't even reunite those families because of, again, incompetence, evilness, et cetera, et cetera. I think it's also created a lot of uncertainty for young adults with DACA. The threat of ending DACA has been really significant and just unbelievably difficult for people who are just trying to be in school and do well and be valuable members of society. It's a huge stressor. And then I think what the Trump presidency has done is that it has made it okay to say inappropriate things about Latinos and other groups. And it has emboldened people in our environment to be mean, to be discriminatory, to intimidate, and to threaten. And so you're not only exposed to, Trump calling immigrants rapists, animals, separating families, but now you could go to the grocery store and you're walking around people who might call you names, because they feel emboldened that they can do that now. Whereas before that, it wasn't acceptable to do. So you have the direct effect of Trump's rhetoric and the indirect effect of Trump's rhetoric, which is just as harmful because it's more close to where you live and you have more direct contact with.
Right, of course. And so I think that was the last question that I had for you, but is there anything at all within this topic that I haven't asked you, or something that you just want to tell me that we haven't covered during our conversation?
Yeah, I think maybe if anybody is watching this video and feeling discouraged by, the topic, what I said at the very beginning about Latinos having a very special type of hardiness, I want to end on that note, and also just to say that there's a lot that goes well, and there's a lot that we do that is valuable, and that we should hold on to those things, whether it's, finding comfort in our music. Well, if you find comfort in music, sing out loud while you're cooking, dance with your children, play the music louder. If you find comfort in your traditional foods, make more of it, eat it. Don't be conscious about whether you're eating too much, but at the same time, nourish your body, nourish your mind. I try to do small things, and I've learned from others about the value of doing small things, like going out on a walk and experiencing the breeze, or looking at the clouds and, imagining what they must feel like if you were to touch them, or whether different colors in the clouds represent different emotions, and, really focus on the things that we do well, like the love for family, the unity of family, whether we have them physically close to us or not. All of those are things that we should hold on to and that are unique to us, and we should feel proud of those things and proud of what we have all accomplished. So many things have been accomplished that were only a dream, at some point in our lives. And we should feel pride and happiness, and that you should not deprive yourself of joy. We need to reclaim joy, and we need to let go of things that are really bothering us and that sometimes we feel like we need to fix. You know what? Sometimes let other people fix those things. So rest, reclaim joy, let go of things that are not up to you to fix. And I'll just end with that.
Well, thank you for sharing that and for ending with that. I mean, like you said, this is a heavy topic. There's definitely a lot to it, but just having that positive note and, you know, being able to say we've accomplished all this so far and it's only up ahead, you know, there's more to it than just, you know, this heaviness of it. But yes, thank you so much for all your time. I really appreciate it. It was a pleasure getting to speak with you about this topic. You gave such great insight into this and kind of how, you know, just mental health in general and with the Latino community and this impact of the pandemic. So thank you so much for all your input with this. It was a wonderful interview.
Oh, good. I'm glad. And thank you for your interest and the space you created. I felt very comfortable with you, and I hope this information and my experience was helpful or will be helpful to others. So thank you. I
No,
appreciate your
yeah,
interest.
of course. Thank you again. I'm glad that you felt comfortable. I'm glad that we got to do this and talk about this. I'm sure it's going to help a researcher out there, a journalist, someone being able to get a sense of this. So I'm going to go ahead and stop recording.